all today. You're very, very welcome to this extremely special event. So as part of the UCD Festival, we're hosting this Kids Q&A about COVID-19 with Dr. Tony Holohan. So you kids from around Ireland can get to ask our Chief Medical Officer about the virus. We're delighted that we have you here and that you're here to answer the question. So we're going to get going. And the first question is from Faris. Faris, can you wave to us to let us know where you are? Hello, hi Faris, you're age 8 and you're from St. Mary's Boys National School in Rathfarnham. So what is your question for Dr. Tony, please?
How did the coronavirus happen?
We think that it came from bats in a part of China, and that humans living very close to animals in the markets where they sell sometimes live animals for humans to eat, and that the virus learned how to jump from the bat into humans and then learned how to jump from one human to another. And that's how it spreads.
Very good. And once it got into humans, then it passed to other humans and eventually got to us. That's a great question, Faris. Thanks for starting us off. The next question is from Killian. Killian, you're age 6. What's your question for Dr. Tony?
Hi, Dr. Holohan. Do we have to wear masks, and if so, why?
So we don't think that you have to wear a mask when you're under the age of 13. It's important that mom and dad would wear one if they're going into shops or if they're going on a bus or a train. And that can help if they have symptoms to stop them spreading that infection to somebody else. So it just gives us a little bit of extra protection. But it's really important to tell your mom and dad they have to remember to wash their hands as well. They have to remember to stay a little bit separate from other people. So wearing a mask is not like a magic shield. It's important that you wash your hands and you do all the other good things as well.
Great.
Thank you.
Thank you.
You're welcome, Killian.
Now we have Cian and Michael, who are age 9 and 11 from Bayside in Dublin. Cian,
what's the difference between a doctor's mask and a homemade mask, and what do we use to make our own masks?
Because when I was your age, I lived in Baldoyle, which is very near you. That's where I was originally from. So I'm just telling you that. So that's a really great question. The masks that doctors and nurses wear in hospitals, they're made in a special way to give proper protection to doctors and nurses, and they're inspected. So it's really important that we keep those masks for doctors and nurses and other people who work in hospitals and in GP surgeries and places like that. You can also make face coverings, and we use the word face covering rather than face mask for coverings that you can wear at home or that you can wear going into a shop or going on a bus or on a train. And you can make that out of simple everyday material like cotton. So like an old t-shirt, you'd cut 2 pieces, fold one on top of the other, and then with elastic, use it to tie it around your ears. And if you go on YouTube, you'll find lots of videos from doctors who show you how the steps that you need to go through to wear a mask.
Good stuff. Well, now you have some practical advice on how to do that. So we're going to move to Evelyn and Edison. Evelyn and Edison. So can you tell us what your question is for Dr. Tony Holohan, please?
How did you become Chief Medical Officer?
So first of all, I had to become a doctor, and I had to work as a doctor for a few years. And then I had to train in a specialty of medicine called public health. So I actually studied to become a doctor in the best university in Ireland, which is called UCD. And then I went back to UCD and studied in a master's in public health. And then I trained as a public health doctor. And that's the training that somebody in a job like mine has to go through. And then I had to do an interview to see if they were prepared to give me the job. And they gave me the job. And I've been in it now for over 10 years. And I love it. It's a really, really enjoyable job.
Why did you want to become a doctor?
Because I enjoyed the idea of trying to help people. And and being a doctor is a very good way of helping people, and a very good way of looking after people when they're not feeling well. And that idea was part of the reason that I became a doctor in the first place. But when I was young, maybe I didn't understand as much as I should have about what it would be like to become a doctor. So it's really important when you're young, think about lots of career options and make sure you try to understand as much about them as you possibly can. Talk to people who are doing the jobs that you think you would like to do before making your decision. And that's really important when you're young. Think long and hard about something. What I would say the most important thing about whatever you decide to do, if you're going to be a doctor or a teacher or a policeman or a nurse or work in a university or whatever it might be, it's really important to choose something that makes you happy. If you're happy at your job, you're really going to be good at it, and you're going to enjoy it.
Hey, hi Josh. What's your question?
When you're on TV, do you get nervous?
Ooh, a little bit sometimes. And whenever you're going to do something important, like an exam, you'll be doing exams when you get a little older, or you're doing something important like you're playing a match, or you're performing some music in front of your class or whatever. If you're not a little bit nervous, you don't perform at your best. So it's okay to be a little bit nervous, but I don't get too nervous because I've done it a lot of times. But if I'm honest with you, I'll tell you, I'm a little bit more nervous now than I'd normally be on TV, because your questions are a lot harder than the ones that I get asked when I'm on TV.
And when you go home, what do you do for fun during this time?
I try to find ways of relaxing. I've got 2 children. They're a little bit older than some of you guys. One of them actually is in first year in UCD, and the other one is in 5th year in Turner College. So I spent a bit of time catching up with my wife and with my 2 children, and just chatting about their days and talking about everything I can think of except coronavirus. And that gives me a little bit of a break, and that's important. So no matter what you're doing in life, it's important to have time to take rest and to relax, and then you'll be able to perform at your best, whether that's in school or whether that's at work. That's an important thing to remember for life.
Great answer, thank you. Josh, do you watch Dr. Tony on the TV in the evenings?
Yeah.
Oh, very good. Well done you for
Thanks,
being
Josh.
to ask the question now. Good stuff. So Ted and Edie, hello, how are you doing? Ted and Edie, what's your question?
Good morning, Dr. Holohan. Our friend Michael is a brand new doctor. My question, I'm wondering if it's safe for doctors to go into the hospital.
Well, that's a really good question, and it's a really important question, because doctors and nurses and other people who work in hospitals, they have to treat the patients, they have to diagnose the patients with this disease. So that means there is a chance of them picking up that infection at work. But doctors and nurses know how to protect themselves. They know the importance of the basic things that we talk about, like washing hands, not going to work when they have a cold. They know how to wear special protection, special masks like we spoke about a few minutes ago, gowns, gloves, goggles, and all of those kinds of precautions that doctors and nurses know how to take, give them special protection from picking up this infection. But it's still a very easy virus to pick up. You've probably all heard of flu, influenza, and we call it flu for short. And in the winter time, a lot of people get the flu, and it's easy to transmit from one person to another. This virus, called coronavirus or COVID, is much easier to transmit. In other words, it's easier for a person to pick this up from another person than it is to pick up flu. So it can be sometimes, even when doctors and nurses take all the important measures they need to take to protect themselves, it can sometimes be doctors and nurses will still pick up this infection. But we know that doctors know how to protect themselves and make themselves as safe as possible.
My question is, how many doctors got the virus?
Well, that's a good question. We know that a few doctors got it. It was probably around 100 or so doctors in this country, and the number changes all the time. And that's because, as I said earlier on, it is easy for doctors and nurses. But in this country, many more nurses picked up this than doctors. So there were a lot more nurses who picked up this infection than doctors. We know when we look at all of the people who work in hospitals and who work in GP surgeries and who work in nursing homes and places like that, about 6,000 people in total who work in those places picked up this. So that's a lot of people. And we have to try and do our best to make sure that we protect those people as much as we possibly can.
Sean, Sophie and Emma are next. Oh, there you are. Okay, hi. What's your question?
Hi, I'm Sean, and these are my sisters, Sophie and Emma. We were wondering if you played any sport as a child, and if you did, what sport did you play? Thank you.
Oh, you're very welcome, Sean. You're the spokesman for the. I had a house full of sisters, and I was kind of the spokesman in the house as well. So that's a very important job, Sean. But you have to let your sisters talk a little bit as well. You know, that's what my sisters always used to say to me. So I used to play a lot of GAA. I played football and hurling mostly, and I played a little bit of soccer with my friends. That was really it. But it's really important when you're young that whatever sport you're in, you play as much as you can. It's good for physical exercise. It's good for mental exercise, and it's a good way of staying in touch with friends. And team sports are really important. And we all enjoy to play individual sports like tennis and so on. But team sports are really important. So whether your team sport is hockey or rugby or GAA or soccer, team sports are really important, not just for sport, but for learning how we interact with each other. Really important to keep those things up. So when it's the right time, which we hope won't be too far away, we'll be able to tell people that it's safe to start playing sports again in the way that everybody enjoys, and that's really important for you as children. So that's a great question on a very important issue.
Great question, Edie. Thank you so much. So we're going to move to Audrey next.
Pets get COVID-19, and can they transmit the disease to other animals like humans?
Okay, so can pets get? That's a great question, Audrey. And you're 13. You go to St. Louis and Rathmines, and your question is about pets, which is really important because we've so many of us have pets in the house. So can they get and transmit the disease?
We know that cats and dogs do pick up coronaviruses, not this one, but lots of other, because there are lots of different types of coronaviruses. Only some of them infect humans. With this particular one, we know that it has happened that cats have picked up this infection. And you might be aware, there was one well-known story that a tiger picked up this infection in New York Zoo from one of the zookeepers. But what we still don't know is if cats can give it back to humans again, and that happens very frequently. So it's really important that we follow what we call a precautionary principle. And what that means, just in case, if you have symptoms, if you have this illness, and if you have pets, keep your pets away from you in the same way as you would keep other people in your family away from you if you're sick, and take simple precautions around hand washing with your pets. If you look on the internet, you'll find on websites like the CDC, which is the American Center for Disease Control, they have specific advice that tells you what to do with pets to try and limit the transmission of this infection, just in case it is possible. But we don't know for sure. But what I can tell you is that even if it is possible for cats and dogs to pick up this infection and to give it back to other humans, it doesn't cause most of the infections that we see. Most of the infections that we see are caused from one person giving it to another person. So the direct spreading of this infection from one person to another person, that's the most important way of transmitting this infection. And that's why we have to be so careful about all the public health measures, like washing your hands, being really careful when you have symptoms and you're using a tissue to be really hygienic in the way that you do that, and all the other measures that we have recommended.
Great, thank you, Audrey. Great question. I have a dog, so I was very interested in that answer. So the next question, Jared. Hi, Jared. How are you doing?
Great.
Good. So you have a question for Dr. Tony about traveling, is that right?
Yes.
Can't wait.
My cousins live in Dublin and one of them happens to be here. I really miss them. Please can you tell me when I will be able to visit them?
So Jared, you're in Belfast, is that right?
Yes.
Good stuff. And you said is your cousin on the call?
Mm-hmm.
And what's her name?
Clara.
Clara. Do you want to give us a wave, Clara? Hello. So you can see your cousin Jared, but you want to know from Dr. Tony when you can meet up in person?
Yes.
Great
I
question.
hope it will be soon, Jared, that you'll be able to visit. Obviously, you're able to do it with Zoom, because if you're able to connect with this, you'll be able to do that. So I bet you're already doing Zoom calls with your cousins and your friends.
So Inez and Tristan are the next people to ask questions, and I think their one might be about travel as well. So give us a wave. Hello. What's your question?
So every summer we go to Spain to see our nanny and granddad and cousins. And will we be able to go this summer?
Oh gosh, that's a good question. I wish I was able to go to Spain this summer as well. I think it's going to be a little bit difficult for us for a while to plan trips to places like Spain, because in other parts of Europe, they have infection. They have infection like this in Spain, and all of the countries in Europe really believe that now is not the time for us to be traveling from one country to another. And we think it'll be like that for a little bit longer. And so it probably won't be possible for us to be planning a trip to Spain this summer. It's now the middle of May. I mean, we're already in the summer here. And so if we think of the time that we would normally go on holidays, June, July and August, I think it might be a bit difficult this year for us to be planning holidays outside of Ireland. And so we're asking people not to make those plans at this moment in time, because you might not be aware of this, but your mom and dad will be aware of this, that when people come back into the country, they're going to have to spend 2 weeks isolated at home before they can go back out of their houses. So we'll have those rules in place, and that won't be a very nice way to end a holiday. So we think for now, we're asking people not to plan holidays to Spain, but we hope that maybe over the next few months, we'll be in a position to say to people that holidaying in this country will be possible, that holidays that don't involve travel by air, and that will be good, that we'll be able to go to other parts of the country for holidays in Ireland.
Good, that's a great question. Thank you. And I'm sure your grandparents will be delighted to see you the next time it's safe to do so. So the next question is from Bara and Killian. Bara and Killian, can you give us a wave? Show us where you are. Hello, what's your question?
Will the vaccine protect us, and will we get to see our friends again?
And we're already saying to people that it's okay to meet up with a small number of people. We're saying 4 people from different houses. If you live within 5 kilometers of each other, that's a short distance of where you live. So your friends that live near you, but it's important that the way when you meet them, you stay distant from them, at least 2 meters, so we don't spread the infection from one of us to another. When you ask about the vaccine, that's a really great question, because we asked that question. A lot of scientists and companies are working really hard at the moment to try to develop a vaccine that can be effective in preventing this infection, in the same way as you get vaccinations when you're a baby that prevent you from picking up things like measles and mumps and other infections like that. So we want to develop a vaccine that can stop people from picking up this virus. But vaccines are really hard to develop, and they take a long time. And even when we find a vaccine that works, we'll have to make enough of it to give it to every person who wants it. And I'm sure you won't be surprised to know that everybody in the world wants this vaccine. So if we get a vaccine, everybody's going to want it at the same time. So that will be hard. But people in universities and in companies and scientists are working really, really hard to try to find a vaccine as quickly as possible, but it might take a long time.
Great, thank you, Tony. And I know, Barra and Killian, you had also wanted to know about when the vaccine might be available and who might get it. But I think Tony has already answered that question because your first question was so good. Well done. So Judy and Milo are next. So where are Judy and Milo? Give us a big wave so we can see where you are.
Hi,
Hello, how are you doing?
Hi, Dr. Tony.
What's your
Hi.
question? What's your question?
We want to know when we're going into school again. Yeah.
We think it'll be as soon as we can make it safe. It might not be too much longer away. I know that some schools are continuing to find a way of having teachers communicate and talk to their pupils. Do your teachers talk to you?
Yeah. Yeah.
Do they give you homework every week?
Yeah.
Do they? Really good. And give you, okay, that's good. Because it's really important that you have work to do from school. And so.
And we keep forgetting.
You keep forgetting to do it, do you?
Yes.
Oh, that's not so good, is it? You have to remember to do your homework. You have to remember to practice your spelling and your sums, and you have to remember to read books. All of those things are really, really important, even when you're not in school. I bet your teacher would be saying the same things to you. So we hope that the schools can come back. So we're working really hard with, have you heard of the Department of Education?
No.
So the Department of Education are the people in the government they're in charge of all the schools. So they're working really hard for how those schools and when the schools are going to come back and are going to be open again. And I can see by your face, you're dying for that. You're really looking forward to school being open again, aren't you? Yeah. You can see all your friends again.
Well done. Well, in the meantime, keep remembering, just try to remember to do your homework, and then you'll be back to school when it's safe to do so. Excellent. Thank you.
Okay.
Bye. So our next question is from Evine. Evine, give us a big wave so we can see where you are. Hello. What's your question?
Are we going to have antibody testing for people who had symptoms of COVID-19 and were not tested?
And it's a great question. And there are lots of different types of antibody tests that have been made. And some of them are even being sold that people can buy them. But we think they're not good enough yet for us to be really able to rely on them. They can be used for us to do exactly what you're saying. In other words, to try to identify the number of people who have picked up this infection. So I was looking just yesterday. They've done some studies with an antibody test in Sweden, and they found that about 7% of people living there have had this infection. A little bit more, but maybe not as many as they were expecting. And so it's really important that we're able to understand how many people have picked up this infection, because I bet when you're asking me a clever question like that, you know that not every person who picks up this infection knows that they have the infection because they don't have symptoms. That's why that antibody test, which is a blood test, is really important in helping to identify all of the people who've had this infection, even if they haven't had symptoms. So we're counting the people who've had symptoms and the people who we diagnose, but there are people who have not had symptoms that we probably haven't been able to identify. And that's why we want to have an antibody test, but we know we need to have a really reliable one. And as yet, we think we haven't got one that's reliable enough for us to use in the way that we'd like to use it.
Great, great question. Thank you, Evine. Thank you for that. Our next question is from Anya and Arif, who are in County Meath. So Anya and Arif, you have a question?
Hi, Dr. Tony.
Hi there.
My name is Anya. We play for Blackhall Gales GAA Club.
When are we going back to playing with them?
What's the name of your GA club?
Blackhall Gales.
Blackhall Gales.
Yeah.
So, well, we hope that we'll be able to get children back to playing sport really soon. And we'll be working hard to try and ensure that happens, because we know how important it is. First of all, I know you love doing it. I can see you're in your GA colours, aren't you? Is that your club colours?
Yeah.
So it's really, we know that sport is really important. I'm sure it's something you love. Children love it. We want to get you back to playing sport as soon as we think it's safe. And there'll be things that you'll have to do when you go back to playing sport, like washing your hands beforehand, washing your hands afterwards. But when we think the time is right, we'll be saying that, and we hope it's not too far away.
Good stuff. We all hope that. We all hope that, Tony. That's great. Great to see the GAA colours there as well. Well done.
Yes.
Next question is Sam and Alex. Sam and Alex, what's your question?
Hi, Dr. Tony. What is the most rewarding part of your job?
That's a good question. That's like an interview question. It's a hard question you get asked in interviews. I guess the most rewarding part of the job is the sense that we've helped people. So, and it's not just me. I work with a lot of different people, and I work and I talk to all of the doctors and nurses in the country. So all of us work together as one big team, and it's really rewarding to know that as a big team, all the doctors and nurses and other people who work across all the hospitals and everywhere throughout the country to help to protect people and make them feel better. I think that's the most rewarding part of it, the sense that we're pulling together and all on the same team.
Great. Good, really good question, guys. Well done. Well done.
Yeah.
Question which is from Mary and Cormac in Scull Lorcan. Mary and Cormac?
Keep away people at work.
Did you hear that one, Tony? How do you is it difficult to keep away from people in work?
Some people can find it difficult in work, and some types of work that involve working with other people, it can be hard to be separated or to stay away from other people. There are some people who work in jobs where they don't come into other people. So if you're a gardener or if you're a farmer, your work might not take you into contact with other people. But if you work in an office, you could be very closely sitting beside somebody. So that's why we say to people, it's really important if you can work from home, you should work from home. It's really important if you can have a meeting the way we're having a meeting. We're not all together in the same place. We're in lots of different places and still we're talking to each other. That's an important way of having meetings. So we don't come into contact too much with other people. And we know that will help to stop the spread of this infection and has already helped us to do that as a country. There are some types of work where people will have to go to work and where close contact with other people does happen. But we think the time is right for some of that work to resume now, because we know we have much less of this infection in the country than we had before. But we'll have to be very vigilant, all of us, to do everything we can to try and stay a little bit distant from each other and to reduce the risk of this infection passing from one of us to somebody else. And that's important.
I have noticed, Tony, on the TV, when you are giving your interviews, everybody's sitting very far away from you. So that's good.
Yes.
What you preach.
We're trying to practice what we preach. Exactly.
Good stuff. So we're just going to go back to Sophie and Lucy now. Hopefully we can sort the sound issue. What's your question? Okay, sorry about that, guys. So you were asking Dr. Tony, are you worried about getting the coronavirus because you are a doctor, which is a really good question.
So I'm a little bit worried, like everybody's a little bit worried, but not too much, because I know that first of all, there's much less of the coronavirus in the country now than there was a few weeks back. That's the first thing. And then the second thing is, I know how to take steps to protect myself from picking up this infection. But that doesn't mean that I couldn't pick it up. Any one of us could pick it up. So it's really important that we all follow the public health advice. We all do the simple things that we need to do every day, like washing our hands, like staying a little bit distant from each other, like not doing things that we think can increase the risk. In other words, going out and meeting your friends and going on play dates and getting very closely involved with large numbers of people. We think it's not yet the right time for things like that. So if everybody follows the advice we're giving and everybody takes the simple steps, we can all prevent too much of this infection occurring in the community. I know what I need to do as a person to stop myself from picking up this infection. And if everybody follows the advice for them as individuals, we can each play our part in reducing the amount of infection that there is in the country. But we have to remember, no matter who we are, any one of us could pick up this infection. I bet you probably saw that even the Prime Minister in England picked up this infection. So nobody is guaranteed that they won't pick up this infection. So it's really important that every single one of us does everything we can to try and protect ourselves from picking up the infection.
But thank you all for coming up with those questions and for asking Dr. Tony, and thank you to him for his replies. I could see you were all so busy doing your drawings and your colorings while you were waiting to be asked your question. So what I want you to do now is to whatever you've got in front of you, whatever you've drawn, I'd like you to hold it up in front of the screen so that we can all see what you've drawn. Oh my goodness, wow. I'm seeing coronaviruses. Oh, there's banners. Stay safe. Excellent. Oh, I love this. Great colors. Oh, fantastic. Stay safe, everybody. Oh, I love it. That's a really good picture of a coronavirus. I like the little spikes coming out of it. That's very realistic. Excellent. And look at the globe as well. Oh, and there we have lots of lovely colors. Excellent. So thank you all so much for taking part today. So thank you to you kids, to everybody, to your moms and your dads and everybody who looks after you. I want to say thank you to Andrea at UCD Research. I want to say thank you to Caroline at UCD and UCD Festival. And most of all, I want to say thank you to Dr. Tony, because as you can tell, he's a very busy man. And thank you for taking time out of your day, Tony, to answer these questions. So can we all give Tony a big round of applause? Tony.
Can I say something quickly?
Yes, please do.
Can I say thank you to all of you guys for a couple of things. First of all, thank you guys for all the questions. They were all really great questions. They were harder questions than sometimes I get asked by other people. So they were really great questions, and you really had thought about them quite a bit. Can I also say thank you all for all the work that you're doing, washing your hands, being really careful with the symptoms that we've talked about, helping your moms and dads around the house. That's really important during this when we're spending so much time alone, and keeping up your schoolwork. That's really important. The lessons that your teacher gives you, reading books, all of those kinds of things are really important. And thank you for all the drawings. I'll let you into a little secret. I'm really glad that Claire didn't ask me to do a drawing as well, because there's one thing that I cannot do. I cannot draw. And I definitely couldn't draw anything as good as the pictures I've just seen. So thank you so much for that.
Great. Thank you, Tony. And I think just
Bye-bye.
Let's all say, can we all say thank you, Tony, and the frontline workers while we give a big round of applause? So after me, 1, 2, 3. Thank you, Tony.
Thank you, Tony.